But right now, let's talk about this. Toronto officials have held their last weekly scheduled COVID-19 briefing as vaccinations continue to rise. We've got over 70% of adults in the city that are now fully vaccinated. And again, as mentioned, this is now changing our vaccination strategy, moving more with a focus to mobile clinics. This is good news. Mayor John Tory joins us now for his weekly check-in. Good morning to you, Mayor Tory.
Hi, Mel.
All right, so listen, I've got to give a round of applause to everyone who's been involved in our vaccine strategy here, because the numbers tell an incredible story in that, over 70% fully vaccinated. People are doing their part, going to these clinics, going to the pop-up, wherever they need to go to get those shots. The supply is there, but it's being tweaked, right? It's being tweaked and fine-tuned to where we need it to happen. So can you talk a little bit about this rollout and which sorts of neighborhoods we're looking at and targeting?
Sure. I mean, I think it's like any other campaign of its kind, and this is a campaign to get to a much higher number. And, the first phase, people will come to you to get their vaccination because they're motivated, they're not hesitant, they may not have barriers in the way, so they can find their way to these clinics. And they worked well to the point where we put into people's arms 4.296 million doses as of yesterday. But you do reach a stage where you have to go to them. Because of people, and we've studied this very carefully. We've gone door to door and asked people questions, and there are people that have hesitancy about vaccinations. They have some lack of trust sometimes in the healthcare system. They have some barriers, whether it's language or otherwise, getting to these clinics. So we're taking the vaccines to them. So this weekend, for example, we're going to have 9 pop-up clinics in a neighborhood called Taylor Massey, which is, say, Victoria Park, Danforth, that area. And we're going to locate those clinics in grocery stores, right outside or inside grocery stores where we know people in that neighborhood do their shopping. And it's a neighborhood where the vaccination rate is well under that average that you talked about, which is pretty close to 75% of second dose. And the hope there is that we will capture those people in the context of being able to, first of all, have them get a message, which they will, on their telephone from a trusted local doctor. Second, they'll find the vaccine is being given at a place that's very close to their own homes and places they're accustomed to going, and that we'll be able to persuade them and get over some of the hesitancy that some of them may have about getting vaccinated. So that's the kind of shift in strategy we're going to do. And by freeing up the people who work in the clinics that are going to close in mid-August, we'll make those people available to do more and more and more of these pop-up and mobile clinics, of which today we have 37. So that number will rise as we make this shift.
So shifting the conversation here, when we talk about businesses, you've been very outspoken when it comes to bringing together all levels of government to have a big conversation with some guidelines, some strategy, so that businesses aren't left to their own devices to decide. We've seen what happened to a handful of Toronto businesses who've made the decisions on their own on what it means for who's vaccinated, who's not, what it means for clientele, what it means for staff. It's a very gray area. Is there any progress in those conversations?
Well, the fact is, we're having them. I guess that's progress that we're having them. I did have a conversation with the Premier, and we've talked to his office. And I just think, I heard yesterday, I met with all the big employers, or many of the big employers from the downtown yesterday, because I'm trying to encourage them to have a timetable and to make statements to encourage, on a gentle basis, people to come back to work downtown. A lot of them are going to do it in the fall. They're going to do it on a kind of a hybrid basis where employees work part-time at home and part-time at the office. But, they were telling me about the fact that they can't afford to have a lot of confusion about different things that people are going to experience when they come downtown. And one of those could be exactly what you made reference to, which is a hodgepodge of some businesses that have one set of rules with respect to vaccination, others that have no rules. I have no political axe or philosophical axe to grind whatsoever on this. I just think we need to have some guidelines, or at least have a discussion on a very practical basis, so that what we don't have in the fall is utter chaos, which we've seen before when you have all kinds of municipalities and governments, all kinds of businesses, schools, hospitals, all with their own set of rules, and people can't figure out which end is up. And so I think there is an obligation to have a sit down, to have a discussion, to not have it based on political philosophy or political divisiveness, just on the practicalities of people trying to live their lives, businesses trying to get back in shape. And I think that's necessary. Some kind of a plan is necessary, and everybody's afraid to talk about this.
Mayor Tory, we run out of time here, but in 30 seconds, you just put out a release here about traffic calming in some zones, and this is really important, especially with back to school right around the corner. Can you very quickly just talk about some of these intersections that you're targeting in our city? Because we've seen a number of collisions out on our streets. Traffic is picking up in the downtown core, that's for sure.
Yeah, 18% of collisions involving pedestrians that are fatal involve left turns that people are making. And you know what happens? You make a left turn and you're sort of busy concentrating on the traffic coming at you, the traffic behind you, the pedestrians crossing, and that results in a lot of collisions, which will result in injuries and fatalities. So we've put some rubber bumps onto these intersections, including Eglinton and Brimley, Victoria Park and Shepherd, Mount Pleasant and Merton, to cause people to stay in a proper arc and not to kind of cut the corner, not to speed, so that they can make these left turns safely. So that we're doing it in 8 pilot project intersections to see how it works and see if we can make those intersections safer. And if it proves to be good, we'll roll it out to more places in the city. It's done in New York City and other places. So we're doing it now too.
Okay, we'll keep an eye on that. All right, I know we have run out of time. We've gone way over, but I'm going to send you way over, like a few meters that way to Dina and Sid, because they have some explaining to do with the fish. I know you had a bit of reaction to the fish.